Okay, Ashley Phillips. I'm really looking forward to this conversation. It's been something percolating in my head for a while. I remember a few
Mm.
years ago, just you explained to me, we went on a walk, and I remember you explaining to me a little bit what EMDR was. And because I would say, like, obviously, I've heard of counseling, I go to a counselor myself. But
Yeah.
I didn't really understand that there was different modalities. Um, just almost that, you know, there's different ways to work on our mental health or things like that. And so I remember spending a whole time going for a walk, and you explained to me specifically what EMDR was and gave me some examples. And so as a physio, I see lots of people, they think of someone like myself for physical issues. Like they come in with pain or fear of movement or different things like that. And then in getting to know them, sometimes I can hear that, you know, there's an event that is tied to this fear or an event that's tied to this pain. And I'm always kind of like, oh, I wonder if this would be an opportunity for EMDR therapy. And so I picture that this episode would be a good way for you to explain what exactly it is so that someone like myself can share with clients what they might be able to expect so they can decide whether this would be a good option for them or not. So, again, with all of that said, thank you for spending time with us today. And I'm wondering if you'll start by introducing yourself.
Would love to. And I'm excited to spend the afternoon with you too. I am Ashley Phillips. I am the founder of the Kelowna EMDR Clinic here in Kelowna. I have a master's of education in counseling, and then I am a big believer in EMDR therapy. So I am a certified basic EMDR therapist. I am a consultant in training, and I'm just wrapping up all the details and the paperwork to become an approved consultant.
Cool.
Yeah.
And so one of the things that I think about, like I like analogies, and I think about us as physios. No two physios are the same. Like we all come out with a basic education, and then often we find different interests that um, we get extra training in so that it becomes, let's say, more comfortable with us. And so, like, think of something like IMS. Like, I don't have IMS certification, but other physiotherapists do. I happen to do a lot in the area of the pelvic floor, pelvic health, or maybe perinatal or perimenopausal, what have you. But I will almost think of it about like different little areas of specialization or different areas of more attention. And I'm guessing that's kind of what EMDR is that no two counselors are the same. You come out with a basic education, but then you find out what's you're interested in, and you might take more courses in that area, but then it's almost like a tool, right? Or a kind of like a form of counseling. Can you just like basically just like what is EMDR? What does it stand for? What does it mean?
Yeah. So EMDR is its own psychotherapy, and it stands for eye movement desensitization and reprocessing. So, bit of a tongue twister. And in essence, this is a trauma therapy. EMDR, the whole point of it is that it dissolves trauma from our brain and nervous system so that it is no longer disturbing to that individual. In essence, that's the biggest picture, narrowing it down into it clears and dissolves trauma.
So, can you tell me? Well, I'm going to just start with one patient that stands out in my mind that came in, and I think it was shortly after you described that to me. She was going just kind of wrapping up kind of her EMDR therapy, and she had been involved in some childhood sexual trauma that she didn't really actually start to kind of realize until she was a little bit older. But she said it was a really big thing. It was showing up for her as pain with intercourse, is kind of what the symptom was that she was having. But then as she started kind of diving deeper and saying, like, I actually am having a hard time with having relationships with men and wanting to have any sort of intimacy. And so she described to me in her therapy that there was a lot of time spent almost like being in that young body again, if that makes sense. And so I wonder if you'll just like, that's just one example, but I do think it would be really helpful if you'll share some different examples that represent different cases or different people. And,
Right.
you know,
Right.
let's just talk about that because I'll have others to share as we go.
Yeah. So, like, in essence, is that what we know about trauma is that trauma kind of gets like stored in our brain. So when you mentioned that whole like feeling that younger kind of self, like that's what it is. It kind of gets locked in like age development. It gets locked in the picture, the sounds, the thoughts, the feelings, and it's kind of like we're stuck in trauma time, right? So as we kind of grow up and go throughout our lives, it's like we get that same feeling, maybe that same flip of the stomach, or maybe it's that same belief system, or certain sounds you just hate that sound. It just triggers you every single time. It can look a lot of different ways. So it's more about when we are getting triggered in our day-to-day life, is there a pattern to this? Because that can be a sign that there's trauma. So when we think of examples, I mean, it can be so broad as to how it can show up, right? So that's what it can make it a little bit challenging. But if we look at it from more of like a PTSD perspective, it's when we have like recurring memories that just keep showing up over and over again. Like this memory is always kind of there, it keeps showing up. We're having nightmares, we have flashbacks of events. Also, the avoidance, that's a really big thing that we might be avoiding places, we might avoid thoughts. As soon as a thought comes up, we're like, mm-mm. We try to avoid feelings. If we feel sad, we're like, nope, mm-mm, no, let's shove that down. We might start avoiding like places to go, activities or situations. So there's a lot of avoidance kind of structures. I also think a lot about like the belief system, like no one loves me, no one cares, I don't matter. I don't trust anyone. I don't trust the world. I'm not good enough. Like I'm unlovable. Nobody loves me. Like when you have a lot of that same story kind of going on, again, that can be part of a trauma response or part of trauma. And also like you can either have it where it's really invasive with memories, or you're like, I can't really remember that event at all. Like I know it happened. At least I think it did, but I can't really recall it. It can also look like just having like really large chunks of missing time where like I don't know what happened like during this part of my life. I couldn't tell you. That can also be a sign. And also just a lot of like emotional reactivity, like a sound goes and you just, jump,
Mm.
right? Like just that like big emotional reactivity. And sometimes it can look like that the response is bigger than what you would expect. So if I were to, let's say I was having a conversation with someone and, maybe we're an employer and we're talking to an employee and we say, hey, like you're doing really great here. Here's some room for improvement. Would love to see this. And, and you're doing a really great job. And that person takes it as I'm the worst. My boss hates
Mm.
me. Like I'm going to lose my job. I'm pretty sure
Mm.
that's not what the boss said at all, but that's where it goes. So again, that can be another sign that like that there's some trauma that's involved. So it can kind of look like several different things. So it's kind of broad. But at least this is the PTSD side of things.
Can you just describe, because when you and I first talked about this, and I don't know that you'll remember, but you had such a good description or analogy that you shared. It had to do with a filing system. Do you remember? Do you use this still? Okay.
Yeah.
Will you share that at this time? Because I use that to like describe to my clients, and it really resonated with me.
Yeah, so I use this quite a bit. And so how I think of trauma is that oftentimes like we don't really see how really things are connected, right? Because when trauma happens, it gets locked and stored in that moment. So it's everything that we see and hear and feel, like you name it, it's all kind of locked in. And so when we're using EMDR, we're thinking of targets and we're looking at like how certain life events have impacted us. Sometimes it doesn't really make sense to like the client as to why this thing is a traumatic event, but it is because it's how the brain associated everything in that moment. So it's like we open up like a filing cabinet and we pull out this filing folder and it's a yellow folder and we open it up and it's like a glass of water, a picture of a person, $20, a plant, and a cow. And we're like, why would the brain file all of that together in a folder? Like that makes no sense to us, but the brain is like, yeah, but during this time, like we heard a moo, we saw this person, like it
Mhm.
connects it all that way. And so while it doesn't make any sense to us, the brain is like, it always does. So it
Mhm.
stores everything together, even though it doesn't make sense to us at that time. And usually during the reprocessing phase of EMDR, it all kind of gets figured out, and people are like, oh, that. Right. So in one case that I read, it was an individual who like hated the color yellow, absolutely hated the color yellow. Like they hated it. They were actually kind of scared of it. And what they kind of discovered during the reprocessing part of EMDR is that they had a memory that showed up that their abuser was actually wearing a yellow t-shirt.
Mm.
And this is what scared them. So it wasn't that yellow is dangerous. The man inside that shirt is dangerous. He was doing a very bad thing, but the brain associated the color yellow to bad and dangerous. So once that was cleared out, the person was able to look at the color yellow, being like, it's the color yellow. And with no reaction, they now like the color yellow. Everything is now okay. Does that make sense?
Oh yeah, and I think right away I listen to that and think like the number of people that just think something's wrong with them, or
Yeah,
that like oh this is just who I am now and this is never going to get better. But I think once you understand how the brain works, like the brain is a very fascinating thing, but it's also very malleable.
amazing.
Like it got there for a reason, and it I always think of the word like perseverate. Like it like it when you talk, it makes me think that it like perseverates, that it can't get past something, or like it definitely tags something. But that's, I think, the cool thing that a lot of people don't realize is that you can change that, right? Like you can,
Absolutely.
that's not forever. It's just that that's the brain's as association or what have you.
Yeah, it's all the associations, right? The brain's job is to protect us, right? It's
Mhm.
to keep us safe and protect us. And so it's going to like essentially file things together that kind of like logically don't make sense, or logically like the color yellow is safe, it's not bad, but the brain is like, but it must be because bad things happened when we saw the color yellow. So it shows up in these kinds of ways.
So
Yeah.
so it makes sense then why like something like, and again, I'm not necessarily going to use these terms, right? Just because I don't work in your field, but people will call it like talk therapy. But it makes sense then probably why like you go to talk therapy and you almost can't get to the bottom of it because you almost like, I just can't make sense of it. But again, that's that file that you might not logically be able to make sense out of it. And so I think I hear a lot of people say, like, if I bring up like, oh, have you ever talked to someone professionally about this? Because I'm hearing things that make me think that this physical issue is tied to this event or tied to this story. Oh, I've tried that. Like I talking about it doesn't help. And so can you speak a little bit to how I'm using the term talk therapy lightly because again, I'm not saying it's necessarily called that. It's just what a lot of people call it.
Yeah,
Can you
exactly.
speak a little bit to like how is EMDR different? Like what does it look like for a person?
Yeah. So the one way I like to explain it, it's that a lot of times therapy can look like it's like every Saturday morning we go out and we mow the lawn, and the grass grows and the dandelions are there, and every single Saturday, like we're just mowing the lawn. EMDR is about taking the dandelion out from the entire root system so it doesn't grow back. So EMDR like essentially clears that all up, all the dandelions are gone. So therefore, you don't have to mow the lawn every single Saturday to get rid of the dandelion.
And
It's just
how, yes, and how like I'm going to use an example here. Someone that I sent over because she was someone I knew fairly well. She had had a C-section and a lot of complications after. And she's like, I just like can't get over it. Like I'm angry,
yeah,
I'm ticked off, and I almost can't enjoy my new baby. Like I can't get over it.
yeah,
And I just was like, hey, I wonder if you should try this. Like phone Ashley or whatever and just ask her if this would be appropriate because this is what I'm hearing. And I like I'm not necessarily going to get these details right, but I feel like it was like a few sessions. She's like, I've moved past it. So, can you just describe then like when someone, if you're going to explain to someone what is this process going to look like for them? Like what
yeah,
happens when they come in to see someone like yourself for that appointment?
yeah. So In the first session, essentially, I'm doing history taking. I'm trying to understand like what the problem is and what's going on, and if EMDR would be the right fit for them. Like, is this a trauma-based thing? And typically with childbirth and trauma, like typically know that in the first session, I know exactly where to go. But that's kind of what's going to happen. The first session is me just understanding what the problem is and if I think EMDR would be a good fit. Like, is there trauma bits that are going around? In the other sessions, we're then looking at preparation. So preparation phase of EMDR is essentially helping someone to feel comfortable to be uncomfortable. Because when we process these memories, we're essentially being 1 foot here in the present moment and 1 foot in the memory, and it's uncomfortable. We might be crying, we might have some really great insights, we might feel fine, and then tearful again, and then angry. So the preparation phase is all about just being like, can I handle being uncomfortable? The next kind of parts phases is about the reprocessing phase. So that's when we're going to bring up the traumatic event. We're going to get a picture of it, what we believe about ourselves, the emotions that we feel, the body sensations, and then we're reprocessing. The reprocessing phase essentially is bilateral stimulation, which is getting a person's eyes move back and forth. Maybe it's up and down. We're doing some tapping. And throughout this process, it kind of goes a little bit like this until the person can now think about that memory and they see in a completely different way. Like instead of it being like this narrow view of I can only see like this part of the memory, I now see all this, all the other parts that, oh my gosh, like someone was right there with me over there, but I didn't see it at the time. Or maybe they can see the whole memory and it's just like neutral. They're like, yeah, like I'm fine. I'm totally fine. I was totally fine during that. Or maybe the image and the memory just becomes like really like fuzzy and they can't really grasp it anymore. Because the brain is like, yeah, I guess we don't really need this
Okay.
anymore.
Yeah.
Just don't need this anymore. We're safe. And so it can show up like that. We process it to a zero, and then we kind of hit all the targets that are associated to that trauma, to like the presenting problem until it's all cleared. And if necessary, we might do like a future template. So when it comes to like pregnancy, it might be like, okay, so if you were to get pregnant again, let's run movies of like the entire process from like kind of almost like from when you find out that you're pregnant all the way until maybe giving birth and the after. And if there's any like icky feelings or we still reprocess that until they can imagine like the future where there was any triggers that now are going to be neutral for them.
And I remember one of my takeaways when you were describing like the file system to me, correct me if I'm wrong, but that eye movement is and something about that eye movement is enabling us back into the file system to almost like have another look or to kind of like make it make sense. Can you just tell it in better ways than what I am?
Yeah, so with the reprocessing, they're still not 100% sure why it works. There's some really good theories, and they're probably like a blend of a few of them as to why they think it works. So when the reprocessing phase is happening, essentially we are having a person like in that memory, but they're also here. And we're using like this different taxing system. So having the eyes move back and forth, maybe doing this binaural stimulation. So we're really, really working the taxing memory so that it degrades the memory. Like people can't do like two things at once, right? Or three things at once. Think of it like texting and driving. You can't really do texting and driving. Either you're driving or you're texting. So the more that we really work the brain while it's holding on to this memory, the more that this memory degrades.
Hmm.
That's one way of looking at it. The other theory is really looking at how we are kind of dissolving the trauma in the brain so that the neural networks can kind of link together to get that information. I hear this a lot in counseling where it's like people are like, I know that I'm safe, or I know that I'm lovable. Like I know that I'm a lovable person, but I just don't believe it. I
Mhm.
I just don't believe it. And when I hear that, that's also a sign that it's like there's this adaptive information that is missing. Like I know that I'm lovable, but I just don't feel it. Or I know that I'm safe. I know it, but I just don't feel it though. So when we're in the reprocessing, when we're getting this bilateral stimulation going back and forth, it actually links everything together so that like everything is talking together. These neural networks are linking to be like, oh yeah, like I am safe and I believe it fully to my core, or I know that I'm lovable to my core. It really helps to upload all this information that we know to be true. And if we don't happen to have this information, like this adaptive information that like I'm lovable, then we're doing other work as well so that it kind of will land and the person will be like, yes, I am lovable. If they don't really have that like really there.
Can you um can you share some examples like or some maybe examples you're allowed to share or that people that might resonate with people like maybe some themes that come
Yeah.
out often.
Yeah. So themes that I see often, like I see so many individuals. The themes that I see a lot is like I have the skills, like let's say I want to go talk to my partner or my friend about my needs or something that bothered me, but every time I go, I just can't seem to do it. I just kind of seem to shut down. Like I have the skills, I know what to say, I know how to do this, but whenever I go, it's like shut down and I can't do it. So that is a sign that there's some trauma stuff that's going on that EMDR could be helpful. I hear it when people are doing lots of avoiding, like I really want to go to that party, but I just keep canceling. Like I just the thought of being around people just is too much for me. When there's depression and they're like, I just can't get up. Like I just don't want to get up. I've lost all interest in activities. I don't really want to go. I see this with chronic pain, quite a bit with chronic pain, especially when they cannot find the source of medically what's going on. Chronic pain is a very good indicator that there might be some psychological trauma that has happened, right? The body is going to hold on to trauma, and it's usually and always going to be physically as well. So if we have continual like tummy issues, if we have the continual pain, that's another indication that they may benefit from EMDR. So I've worked with people that have chronic fatigue syndrome, individuals that have had challenges in their relationship where there's been lots of trust issues. And the trust issues are more about them and they know that. They're like, I know I can trust my partner, but I just feel like I just can't trust them, even though there's nothing there that would really tell them that I can't trust them. And so when we do reprocessing from their previous relationships or previous traumas around trust, they get to the point of like, yes, I can trust my partner. They have shown that they are trustworthy. Um, Definitely in sexual abuse cases. So if an individual has experienced sexual abuse, it shows up like physically with various gynecological issues. They might have a lot of tension in their bodies where they feel like they just can't relax. Maybe when they are around certain individuals. So if it is a reminder of the perpetrator, whether it's conscious or not, they like again like that can be another sign that if we don't want to be around certain people or people make us afraid, that's another indication, especially when like there's been no evidence that they haven't done anything to harm that individual.
There's a few people I just want to share like a few people that come to mind. There was one woman that came in with a lot of bladder urge, and she just said, I always have to go pee. I always have to go pee. And, I always start with the anatomy, explaining to them how everything works, but then also explaining that our body needs to be able to relax, like that we're not supposed to be in like a fight or flight response all the time, and describing that in order to pee, we need to let go. And she's like a light bulb went off. She's like, Melissa, I grew up in a very abusive home. Like I wasn't hit, but my mom was always hit. And I realized in order to not cry, I needed to go in my room and hold everything tight. Like, and you could just see she's like, okay, there's more than one thing going on here. This is not just a bladder issue that, um, you can see that a lot of people all of a sudden there's like click. And some people are ready for that. And other people are like, I'm not going to be coming back for a while. Like, I just need to simmer on this, you know?
Yeah,
It's
it's
big.
a lot of information, right? Because we know our bodies, like it's like there's that book, The Body Keeps Score.
Mm-hmm.
That is a heavy duty book. I would not recommend it for most people to read because it is like a very textbook heavy
Yes.
and at times graphic book. So I know that's a very difficult book for individuals to read. For professionals, it's more of a better fit. But however, it's like our bodies keep score, our body remembers. So if we don't have any memories, but our body is constantly in this fight or flight response, if we're holding on to things and we're going to massage and we're going to physio and
Mm-hmm.
like it's not working,
Mm-hmm.
that can very much be the sign that there's trauma there that needs to be like resolved. And we have therapy that it works. And clients may have been in therapy for years and are like, Ashley, I've been to therapy for years and
Mm-hmm.
years. Nothing has changed. And it's like, yes. And have you tried EMDR? Have you tried trauma-based therapy? That is a very big difference between talking it out all the time and actually resolving the trauma.
Mm-hmm. Totally. And I'm another example because I think some of these will resonate with people. People coming in kind of like, I my core is weird. So I need help. I can't figure out my muscles. And as we start exercising, I'm always curious, like, does it feel like do you have symptoms that like is there signs and symptoms that your body doesn't like doing this? Or is your head telling you not to do this? Like, do you feel nervous about this movement? And yeah, I'll never forget this one woman that very much shared, like, I can't trust my body. Like, so she was looking for me to like tell her what was okay. And I was like, I can't. I can show you how to move and things you're looking for and explain how it works, but I can't tell you what's okay in your body.
Yeah.
Yeah.
Yeah. And that's like those can be other pieces. So it's really fascinating just how our body and or really how our brain really just is like whoop. And
Hmm.
it's like these little moments, like it can be these little moments in time that at the time when you look at it, you're like, that's not really that big of a deal. But that was the moment that the brain put together of being like, I can't trust my body.
Hmm.
Mm-mm. And it can be a very small thing, a very small memory that really doesn't seem like it should be that significant, but it is.
Well, and that's why I think like some people will be like, well, so and so had that experience. And like, again, I must be weird because my body responds differently than them and they went through the same thing.
Trauma is subjective.
Yeah, exactly.
Trauma is subjective. Trauma is subjective to each individual person.
Yeah.
It is a subjective thing. And so, especially after, let's say, like birth trauma, for example, it is subjective. So, what would be like rented, like that's just like regular day for like someone at the hospital for your medical team? That is not the run of the day for you. And therefore, it is a traumatic experience for the patient. It's definitely not for the medical team.
Hmm.
Trauma is subjective. So, what is traumatic for me will not be what's traumatic for you.
Hmm.
That's why when there's a car accident, some people will have PTSD, others will not.
Hmm.
That's why some women will experience PTSD after giving birth and others will not. Like there's so many factors that are involved. There's so many factors, like what was going on before, during, and after. And what I
Hmm.
find so much, like what I I see so much on repeat, it's the aloneness. Like in that moment
Hmm.
when this thing happened, and if it even if it felt small or if it was really big, they were alone. There was no one that they could turn to, or someone just left. Like it wasn't necessarily the trauma itself,
Hmm.
it was the aloneness.
Hmm.
And that's not every single time, I want to be
Hmm.
clear, but it's a pattern that I've noticed when there was a car accident, when there was a birth trauma, like when any of these moments happened, they were all alone and there was nobody there. And that's
Hmm.
what made it so like so upsetting and disturbing and distressing for that individual.
Hmm.
Yeah.
Um, I have a question about the therapy itself, but I was chatting with you the other day about another example that I thought was really interesting. I asked this person to go home and I wish I would have had this episode to share with her at the time, but her goal was, I wish I could poop better. And so, like I think naturally as pelvic health physios, I would have done this when I first started working. I'd be like, let's look at the pelvic floor. It's got to be a pelvic floor problem. But then now that I work longer, I'm like, nope, go big picture. What do you mean? Like what's wrong with your pooping? And she's like, well, I can
Yeah.
tell you as soon as I sit down to have a meal, I can tell you which type of poop I'm going to have. I was like, what do you mean? Like most people don't think about their poops when they sit down for dinner. And so what do you mean by that? And she said, well, I'm either going to have diarrhea or I'm going to have like constipation. And I know as soon as I take the first bite. And I was like, huh. And we started talking. I'm like, sounds like an association. Like that I said, normally when we eat, it's supposed to be like very parasympathetic and where it's not supposed to be so like kind of fight or flight. And she's like, oh my gosh, the number of tummy aches I had as a kid. Tell me more. And like she like I lived in a house where my parents fought all the time. I got a tummy ache every time I had to move between homes. And so again, I explained to her kind of like how our digestive system works. And like that my expertise lies in like the bottom, like in the valve and like how your poop comes out of your system. But it sounds like before it even gets there, you've got this response. And like you're a new mom and you're overwhelmed and finances are limited, but I wonder if you want to divert your finances to something else right now. Like, because I don't, yeah, sure, I could give you some tips for your pelvic floor for your well-being, but if your goal is to poop better, I don't know that this is where we need to start. And so this is what I wish I would have had I described to her the best I could what EMDR therapy was. And I wish I would have had this episode to send home with her. Cause I was like, I wonder if this would be something that would be worth investigating.
Yeah, and like when you talked about that, it just reminded me of like when there's been like lots of conflict in the home and we grow up in a place that there is a lot of conflict, like we're going to be constantly like heightened, right? And some individuals will grow up like feeling that there's something wrong with them because like they can't relax. They can't relax. They feel like they're always on guard and they feel like there's something wrong with them. And I remember the moment where I described this with someone of like, well, actually, like when you live in a house that is dangerous, where there's lots of yelling and screaming, and you don't know like if this person's going to hit you or not, your body's doing exactly what it's supposed to do. It's supposed to
Mhm.
be in a fight or flight response. It is not supposed to be like relaxed. That doesn't make any sense, right?
Mhm.
Like, you're supposed to be like this. So your body did exactly what it's supposed to do. Just the problem is that today, when you're in your own home and like those people aren't there and it really is safe, your brain is still acting as if I need to be like this. It's still not okay to relax. So it's just like this moment that needs to be reprocessed so that your brain knows like the past is in the past versus the past is in the present, right?
Mhm.
So at the time, you did exactly what you need to do, fight or flight. It's a dangerous household.
Mhm.
Now you're in your own home, your parents aren't there, you're maybe living by yourself or in your good relationship where there is no threat. It is now okay to be safe, to be regulated in your own home. So we just have to get the brain up to speed on the fact that you're not living in that home anymore.
When you describe this reprocessing, I can see how, and this is something I asked you because I wanted to know your advice on like, can you give me a recommendation? I have some things that I feel like I need to work through, but I'm scared. Like I'm scared to do that because I'm a mom of two young kids and I don't want to go home crying every day or I feel like I'm already at my max capacity. I don't want like I want to do this, but when's the right time? So can you just answer that for people like because it sounds scary like to go to some of those places, right? And so what's your answer to that?
It's always the right time. It's always the right time. So the therapist that you work with, their job is to make this like a safe experience for you. Their job is to help keep it contained enough so that you can reprocess these events. The whole goal isn't to just open up all this stuff and then reprocess the stuff and then send you on your way where you're now debilitated and you can't function. Like that's not our goal. And we have to look at it from that this is impacting us on the day to day, right? So when we start tackling it and dealing with it and reprocessing it, your days are going to get better.
Mhm.
Definitely, there's going to be some hard days there. It's going to happen. But we have to look at the long term. Like, can we keep going like this? Like, no, we have to start resolving these traumas. We might have some hard days, and that is okay. It will be done safely, it will be contained, and that's our job as a therapist is to do that. But we want to get the symptom reduction down. We want to like have this go like here down to here so that you can go out and start living your life and not have these things bother you. We want to empty out that container for you. We want to start drawing it down because the more that life happens, the more that these trauma ticks keep happening, right? It just keeps building and building and building. And we want to we want to drop it down for you. So I'd say there is no better time to just start getting in there. And your therapist who is trained in this modality, like their job is to figure out, okay, like what capacity do you have? Okay, that's where you're at. This is what we're going to do to start getting this down. There's a lot of ways of doing EMDR, like EMD, EMD little r, and EMD big R. Like it's all this like little package that we have as therapists so that we can get the volume dial turned down on what's going on.
Is there a time where you find that people's triggers show up the most? And I guess what I'm getting at is because not everybody's trauma is childhood trauma, but like, is it accurate that a lot of traumas show up for adults when they're the age that they were when the trauma happened? Does that, when they're kids, sorry, their kids are the age that they were when their trauma happened?
I definitely have seen that pattern. I've seen that pattern working with parents that when their children turn that age, like let's say age 5, when stuff started to happen, when their child turns 5, then things start showing up. And that's a very normal thing that I've seen. So I've seen that pattern quite a bit.
What about around stresses? I've had a few people not too long ago that have come in. They've been in the hospital for different procedures, and then it's like at a stressful time that all of a sudden, oh my gosh, the flashbacks. Like, and does it like also at times of stress?
It's at times of stress, but it's anything that it triggers the memory. And triggers are sights, sounds, smells, touch,
Mm,
taste, anything. So if you smell that hand sanitizer,
mm,
it'll take you right back. If you feel that same kind of sheet that was on your skin,
mm,
it'll be right there. I see it a lot with weather,
mm,
right? Because in Canada, we have 4 seasons. So when the weather starts changing, like it goes into spring or goes into fall, see that so much, that connection between weather and the trauma.
mm.
Yeah. Yeah. Weather's a
Interesting.
big one that we typically don't expect. But again, trauma is stored through sights and sounds and smells. So that smell of rain, if we were in a car accident when it was raining and we get out and we smell that beautiful smell of rain, that now becomes a trauma trigger, which is only going to happen during this time of the year.
I'm going back for a second to when my question around like when's the right time, because I get it. Like any time is a good time. Um,
Yeah.
I'm going to share a bit and say like I actually found that in my sessions I was absolutely emotionally exhausted after, but that was something I scheduled intentionally. Like I wasn't going into work after. It would either be at the end of a work day or at the end of my day, and my husband knew that I was going to come home and not be first class mom. Like mom's going for a bath, mom will eat after we are, like things like that, so that I didn't have to sit in front of my kids at the time. But I think that would be another thought just for listeners, like on a personal note, is just being able to think in your day when it's optimal. And I'm not saying that everyone's going to have the experience that I had at all, but I think that sometimes you don't know till you go to that first one how you're going to feel, if you will, right? But overall, I would completely agree. Like also after that day, definitely a lightening, if that makes sense. Like constant progress, but also just like my body and my brain just really needed to kind of power down after.
Ab-
Yeah.
Absolutely. I've always recommended with my clients, especially when we're in the reprocessing phase, like figure out what's going to be the best time for you. Is it going to be first thing in the morning? And then it's easier for you to kind of contain it because you're like, I'm going to go back to work so I
Mm.
can like really tuck stuff away. And I'm now in work mode. And that's really helpful for me. Or is it more towards the end of the day when it's like, yep, and now I'm going to like go for a walk. I'm going to like actually just take a few moments after the session to really just digest everything. And I encourage people to get like try to get the best night's sleep that they can.
Hmm.
Yeah. Some people do better with appointments on like Fridays, the weekends. Again,
Hmm.
like some clinicians aren't going to work those days, but we do want to try to find like when is the most optimal for them.
Hmm. How long should people expect the sessions to be?
Oh, great question. Ah, I mean, sessions vary.
On
So when
the therapist, obviously, yeah.
yeah, it's therapist kind of contingent. So I run anywhere from like 50-minute appointments up to doing full day intensives with an individual. So a full day intensive with EMDR, we're here from 9 until 4 with like an
Mm.
hour for lunch, and we are just in it doing the work. And we are essentially getting through as much of that material as possible. And we have that lunch break so their brains can take a bit of a breather and rest and digest. And other individuals, we're at like 50-minute appointments because that is what is best for their brain and nervous system.
I just have to share another person that came to see me that it was actually like seeing you at the same time. And I definitely noticed I thought between one appointment and the next, I said to her, I was like, wow, I feel the difference in you. Like just your body language is different. The first time I saw her before you saw her. And the first time I just went to gently lay my hands to find out where kind of like it was safe on her body. Like there was a lot of body language that was like I could tell I was not safe there. And what a difference. Like the next time she came in, I feel like she willingly kind of like lifted her shirt to expose her abdomen and just kept talking the whole time I laid my hands. Like before she would have stopped talking and kind of her body was sussing out whether or not I was safe. It was absolutely incredible. And just her face was lighter. She could talk the first time she couldn't stop crying. The second time the tears were much like less and spread out. I noticed a huge difference, and she said too, like just I'm feeling safer in my body. Hmm.
Yeah,
Yeah.
because the brain is like the danger's gone.
Hmm.
Like the danger's gone. Like it's okay. The danger is no longer here. It happened, right? It's in the past, but it's in the past now. It doesn't have to keep showing up every single day. So we can see these really quick changes because the brain is like now getting processed. Like this trauma is now dissolving. So I don't have to keep holding on to it.
Hmm.
It's all over. It's done.
Hmm.
And so that's where it's like, and it just kind of almost naturally happens. It's not like the person has to think about, well, now I have to relax.
Hmm. No, it's
Like
just
it's just,
natural.
it's just done. Like I remember in a, like with one example, because I really see this with phobias, like a spider phobia, for
Hmm.
example, right? Where like before, they would pass by and see a spider and like freak out and they're down the hall and like, just a complete disaster. And then just walking by a spider and no reaction. And as the family and friends are
What happened? Yeah.
like, what's going on? And the person's just like, what?
Yeah.
They're like, there's a spider right there. And they're like,
Oh,
yeah. They're like, you're afraid of spiders. They're like, oh yeah, I'm not anymore. Like there
that's
just was
funny.
nothing there, right? It
Hmm.
wasn't like, okay, there's a spider there. I have to be brave and like there's just nothing there. That's the thing. That's like the dandelion analogy. Like we're pulling it out by the entire root
Hmm.
system. There's nothing there to be activated by.
Hmm.
That's like I feel like it just changes really quickly, or we don't even notice sometimes the improvement because it's like, oh yeah, that doesn't bother me anymore because there's nothing there. There's
Hmm.
no activation. It's so
So
fun. It's so
yeah,
fun.
yeah. It's extremely interesting. I'm fascinated by the brain. But yes, you see so commonly like the ties. I'm actually curious to ask you then, like, what are some instances maybe like because I've kind of mentioned the reverse of like when someone comes to see me for physical issues, and it makes me think like I think the physical's downstream here, right? Um, can you just share, I'm putting you on the spot a bit here, but like sometimes that it made you think I need to refer to someone that works with the physical body? Like some instances where maybe, yeah, like you think that their physical body needs like some of that reprocessing, if you will.
So like when I say that they need to be referred to like a physio or an
Yeah,
RMT,
something like
yeah.
that. Yeah.
Yeah. I've seen that in like where there's that chronic pain and they
Hmm.
haven't been linked up yet to like the pain management clinic here in
Hmm.
town.
Hmm.
Because they do have lots of great programs and resources,
Hmm.
like talking about like the psychology of pain, but also like actually like getting like medical support around that.
Hmm.
I've seen it where, like in the chronic fatigue syndrome world, where they need that extra support, where I know that I can do my work as a
Hmm.
therapist, but they actually need to learn like what are some appropriate things that I can do that to move in my body that actually is safe
Hmm.
for me to do, right?
Hmm.
If we do have a lot of like injuries,
Hmm.
I want to give them like skills on how to move their body like well, but that's not my area of expertise.
Hmm.
Like we would need like a physio and RMT involved to kind of help them along the way
Hmm.
because it's all about like that skill development. Like I can
Hmm.
help with let's help you not to be afraid to move your body and let's give you those pieces with a professional who can help you to know like what's like the slow and steady way instead of like
Hmm.
let's just keep jumping into the same thing and injuring ourselves over and over again.
Hmm. It's interesting. I wonder your thoughts on this. I had this woman, this was years ago, and she came in and she wanted me to, I want you to help me with my tension in my pelvic floor. Like, not many people come in saying, like, almost like their quote unquote diagnosis. Like, I want you to help me with this. And she's like, I'd like you to actually put your finger inside my pelvic floor. Like, I want you to do that today. I need that for my healing or my therapy. And so I obviously didn't do that within this quick. I'm abbreviating the story here, but when I went in and kind of like touched areas of tension, um, I'll never forget. She said, like, does it feel tight? And I said, yes, it does. The muscles are holding a lot of tension. And she said, why? And I said, there's always a story or something like that. And she just burst into tears, actually. And she was just like shaking. So obviously, like, I took my hand or my finger out of her pelvic floor and just laid my hand on her knee. And she said, like, no, actually, this is super helpful. She said, I've been doing so much therapy and I needed that physical touch to almost like that muscle needed that touch to let go. It was so fascinating. And
Yeah.
and she's like, that's what I needed. So it was almost like she needed someone like yourself first. And then, like, I think I only saw her once, but she very much was like, I could tell it's almost like my brain couldn't let it go. Yeah.
Right. And it's almost like we need that, we need to be almost like to be seen,
Hmm.
right? Being like, yes, I need to be seen. And what does
Hmm.
that look like to really be seen? And that's where like having both sides is just so incredibly helpful.
Hmm.
Yeah.
It was really powerful. So is there anything else that I haven't, overall, I think this has been super helpful. Not only have I learned a lot, but I know other people will learn a lot. But is there anything I haven't asked you that we haven't spoken about that you think's relevant to share?
One thing I think is a really important piece, and I see this so much with what happens at my clinic, is kind of like, well, just go see a therapist who does EMDR, like go see an EMDR therapist. And the challenge is that it's about finding an EMDR therapist who specializes in the area that you need help and support with. So an EMDR therapist, like that is our modality, it's what we do, but we still have like that scope of practice, still our laneway of what we can work with. So if an individual needed support around an eating disorder, we wouldn't see an individual who had EMDR, who's an EMDR therapist, but has never worked with an eating disorder client. We really want to stay in our laneway so that's a really big part of when we're looking and trying to find a therapist who specializes in EMDR is what is like, who do they work with? What's the population that they work with and the issues that you work with so that they can actually be the best person for you. That's a really important piece is finding that EMDR therapist is are they an approved EMDR therapist? Like, do they have their master's? Have they had the appropriate training, like an EMDRIA approved training? And do they work in the area that you actually need help and support with?
I feel like a lot of registered counselors offer kind of like discovery sessions, right? Where you could like people can use that time to just briefly kind of share what maybe they want to work on and make sure that they align with that therapist. Would you say that like everybody should reach out to the clinic that they're interested in, ask questions, whether or not they offer that consultation appointment, or they can talk to the front desk staff or what have you, because yeah, exactly. Don't assume, right? The same thing I tell about
I
people with
think,
physios is like no two physios are the same. So set yourself up by seeing the right one.
yeah, we want to look at their bio. Like their bio will give you lots of good information. So if you're looking for someone that specializes in depression and they don't list that as their area, then that's not going, we already have that information right there that it's not going to be a fit. So we can kind of like look through their bios, see what they say. We can contact like the front desk of the clinic, being like, who would you recommend? Like, who would you recommend? Because usually the front desk staff would have a good understanding of each therapist and what they offer and can really work with that therapist to find like the right fit. But looking at their bio is going to be a really helpful piece.
Oh, okay. Well, I feel like I've exhausted all my questions and thoughts, and I appreciate you and your time and
Oh, it was
your
so great.
wisdom.
Like I know I can talk about this for about another like 6 or 7 hours, like
Mhm.
very easily. And there's lots of resources out there. One really great website, it's called EMDRIA, EMDRIA. It's a fantastic website. They give lots of great information, like just generally about what EMDR is. It's a really fantastic resource for individuals to really learn about EMDR and how it works and different scenarios. So it's really fantastic.
I'll put that in the show notes.
Yeah,
Thanks again, and I appreciate you.
me too. I appreciate you too.